In this multiple choice question, from the given option, they are directing us to specify the correct option, illustrating at which stage of the HIV infection does one usually show symptoms of acquired immunodeficiency syndrome. For this, let me understand the symptoms of human immunodeficiency virus infection in human being. In human being, headache, skin rashes, defective digestion resulting into vomiting and diarrhea, nail thickening, muscle pain, joint pain, all these are all the symptoms of the HIV infected patient. So, with this specification, we are choosing option C as a correct answer. When HIV damages the large number of helper T lymphocytes, why we are avoiding option A, B, and D? Why? Because it is not satisfying the symptom conditions of the AIDS because of the HIV. So we are choosing option C as a correct answer to secure 4 mark. What are the points we told with this option? And with this diagram, we are giving us a recap to take the NEET notes for future reference. HIV does not usually show symptoms of AIDS when HIV damages large number of helper T lymphocyte. That means complementary determinant specific T cell. AIDS is a stage of HIV infection that occur when one immune system is badly damaged and one become vulnerable to infection, and an infection related cancer called opportunistic infection. When the number of one complementary determinant specific cell falls below 200 cells per cubic millimeter of the blood, that means we can say 200 cells per cubic millimeter, one is considered to have progressed to AIDS. With this specification, we are choosing option C as the correct answer to secure 4 mark.